We've been getting vaccines for a long time. For 100 years, at least Americans have been getting vaccinated regularly. But now we can no longer trust the system. We can no longer trust, certainly, the COVID vaccine manufacturers, the FDA and the CDC. So is there any reason to trust them on the flu shots or any other vaccines?
To be honest, my trust level in those institutions is zero. I have zero trust in the CDC and I have zero trust in the FDA. They have shown their complete corruption with regards to industry sponsors, and it's despicable. I believe that the people in charge of those agencies should be prosecuted in court for that degree of corruption. They've shown that their allegiance has been to their companies and not to the American people. The CDC, which was supposed to be an elite intellectual medical public health institution, has put out garbage study after garbage study after garbage study. It publishes these studies in Morbidity Mortality Weekly Report. When I was in medical school, the MMWR was the public health standard, what one looked to see what was happening in public health every week. Now it's the publication of nonsense. It puts out studies that are fatally flawed, week in after week out, fatally flawed studies with 8% response rates, studies using the wrong study design, studies using the wrong controls. It's bizarre that these institutions would put out material like this, think that this passes for scientific evidence, and that it would just breeze through without criticism. So this despicable behavior is just totally unacceptable for the way anything should be happening with our government administration. And for Dr. Walensky, the chief of the CDC, to say, oh, we did some introspection and review, and our problem was that we didn't know how to communicate well enough with the general public, is even more bizarre. It's complete misrepresentation of the failings of the CDC and a complete lack of perception of what her problems are and what the Institute's problems are. I'm not saying that there aren't good staff in mid-level of these agencies. There are plenty of very good scientists who work in those agencies. The problem is that as you get to the policy levels towards the top of these agencies, they're totally corrupted. They know who's paying their bills and they're totally corrupted. And that's a problem that has to change.